Good day everyone. We're Group 2 Team B and we're going to present about thermal burns with our clinical instructor Sir Red Licop, with the members me, Rico Miguel Bilabhata, Monique Gallardo, Mabi Flor Gamila, and Modesto Lozano III. For the learning outcomes, it will be discussed by Mabi Flor Gamila.
So for the learning outcomes, at the end of the presentation, the BSN Level 3 will be able to know and be familiarized with the classifications of burns, deeply understand the pathophysiology of thermal burns and how it all started, determine the normal values of the different laboratory tests and its connection to the disease, discuss the appropriate nursing care plan of the determined problems and to prioritize each problem, and give health teaching to the patient about her condition and evaluate the understanding of the patient. So for the introduction, according to the World Health Organization 2018, a burn is an injury to the skin or other organic tissue primarily caused by heat or due to radiation, radioactivity, electricity, friction, or contact with chemicals. Burns are a global public health problems, accounting for an estimated 180,000 deaths annually. The majority of these occur in low and middle income countries and almost two-thirds occur in the WHO, African, and Southeast Asia regions. Burn injury among older adults will result in significant morbidity and mortality despite the many advances in burn treatment. Despite the advances in wound care and critical care that have occurred, the mortality rates of older adults will burn injury remain quite high. According to Centers for Disease Control and Prevention, vision impairment might lead to decreased quality of life, functional limitations, and an increased risk of mortality. Vision impairment might prevent persons from performing instrumental activities of daily living. Vision impairment can be caused by treatable forms of vision loss such as cataracts and refractive errors along with age-related macular degeneration. Measures to prevent vision impairment and vision loss include receiving eye care and a comprehensive eye exam. For their learning issues, vision or cognitive impairment, understanding of the body surface, and the knowledge of the Rule of 9 classification or degree of burns and the percentage life-threatening. Appropriate first aids in treating burn, nursing and medical managements of burn, physical assessment, cues to pain. What IVF to be administered, reason for the test for burns, knowledge about Hartmann solution, diets, ADLs, knowledge about compressed vertebral disc, its management and health teaching, and moderately severe osteoarthritis, its management and health teaching appropriate to their age. So to discuss the pathophysiology, may I call on Ms. Monique Gallardo.
For pathophysiology, what is the response of our body in burn? Thermal burn po yung nilagay namin sa gitna kasi yun po yung burn na nangyayari sa patient namin. So burn injuries is nagre-result ng local and systemic response, wherein yung local, from the word local, meron siyang specific na tinatamaan. At sa systemic naman, whole body po yung tinatamaan niya. In local response, we have three zones. First is the zone of coagulation, which occurs at the point of maximum damage. In this zone, nangyayari yung tinatawag nating irreversible tissue loss dahil may changes na nangyayari sa structure ng protein na dala ng heat, at ang tawag natin do ay coagulation of the constituent protein. Para ma-prevent, we need a burn resuscitation, which will be discussed in the next zone, which is the zone of stasis. In this zone naman, nagkakaroon ng pag-decrease ng tissue perfusion, which means di na may meet yung metabolic demands ng tissue. So what to do if we have decreased tissue perfusion? Kailangan po natin ng burn resuscitation, nang ibig sabihin ay kailangan ng replacement ng fluid sa mga burn patients para malabanan ng hypovolemia and hypoperfusion na pwedeng mag-result ng systemic response sa burn injury. Lastly is the zone of hyperemia. Nakaka-recover naman po yung tissue dito agad-agad unless meron pong severe sepsis or prolonged hypoperfusion yung patient. In systemic response, we have 4 changes. Systemic response is yung pag-release ng cytokines or ibang inflammatory mediator sa site ng injury that has a systemic effect on the burn, reaches 30% of total body surface area. For the cardiovascular changes, yung capillary permeability po dito is nag-increase, which may lead to loss of intravascular proteins and fluids sa intestinal compartment. Tawag natin doon ay hypoalbuminemia. What happens when patient have hypoalbuminemia? Patient may have swelling sa buong katawan, muscle weakness, and fatigue or cramps. In these changes, may pag-decrease din po ng myocardial contractility, posibleng dahil sa pag-release ng tumor necrosis factor A. These changes kasama yung fluid loss sa burn wound is pwedeng mag-result ng inadequate delivery ng vital oxygen at nutrients sa body tissues, which is tinatawag natin including hypoperfusion, at kapag napabayaan at di na-check, pwedeng mag-result ng organ system failure or death. So in hypoperfusion, meron ding nangyayaring severe hypotension which may lead to damage in the heart and brain. In respiratory changes, kapag severe po yung burn, mag-occur po yung respiratory distress syndrome. So if you have respiratory distress syndrome, pinaprevent niya yung organs na makakuha ng sapat na oxygen para mag-function, so it may eventually cause organ failure. Next is inflammatory mediators cause bronchoconstriction, which means nagko-contract yung smooth muscle ng bronchus, and if this muscle contracts, it causes bronchus to narrow and restrict the amount of air passing into and out of your lungs. So ibig sabihin, pwede pong magkaroon ng asthma attack. In metabolic changes naman po, ang nangyayari po dito is yung basal metabolic rate increases up to 3 times on its original rate, and high values reflects thyrotoxicosis. What happens when you have thyrotoxicosis? Hyperthyroidism will occur kapag yung thyroid gland nagpo-produce ng too much na hormone thyroxine. Hyperthyroidism accelerate your body's metabolism na magkakos ng unintentional weight loss at rapid and irregular heartbeat. Lastly, for immunological changes, walang specific na immune response na nag-occur po dito, but burns can damage the skin protective barrier, meaning meron pa ding mga bacteria na makakapasok. And for the NCP, may I call on Mr. Lozano.
For our nursing care plan, we have 5 prioritizations. Prioritizations number 1 is fluid volume deficit related to decreased blood pressure. For the goal, after 3 hours of rendering nursing care, the patient will be able to improve cardiac output as evidenced by blood pressures and pulse rate, and rhythm are within normal parameters. For the interventions, administer intravenous fluid therapy, Parkman solution, 760 ml per hour as prescribed by the doctors. Assess patient's mental state for signs of confusion, monitor kidney function, monitor eye and O of the patient, urge the patient to drink prescribed amount of fluid, observe complications and infections on IV sites of insertions, evaluates laboratory result, administer calculated IV fluid as prescribed by the doctor, Parkman solution, receive 760 ml per hour. For prioritizations number 2, we have respiratory infections, related tissue distractions, and increased environmental exposure as evidenced by extensive burn injuries. For the goal, after 3 hours of rendering nursing care, the client infections will be lessened, understand the wound care, and aware from infections. For our interventions, we have performed daily wound care, document and note changes appearance, odor or quantity of drainage. Observe localized signs of infections at once, provide proper wound care dressing, and observe aseptic technique by use gown, glove, mask, and strict aseptic procedure during direct wound care, and provide sterile or freshly laundered bed linens or gowns. Implement appropriate isolation technique as indicated. Administer antimicrobial medications depends on the doctor's order, salvinitrate, basitarin, or hydrogels. For the prioritizations number 3, we have impaired skin integrity related to extensive burn as evidenced by patients' back and upper arms are pink color and don't blanch on palpations and developing blisters around the edge of his back and down the dorsal portions of both legs. Secondary to 20% partial thickness or deep second-degree burns. For the goal, after 2 hours of rendering nursing care, the client wounds are clean and dry, maintain the vitals, and improve to normal range, and no and free from bleeding and infection cues. For the interventions, keep the skin free from pressures and encourage change positions to the uninfected area. Then provide wound dressing, wash gently with mild soap, use amount of antibiotic ointment, and non-stick dressing. Observe the aseptic technique procedure. Client are free from bleeding and observe signs of infections. Maintain the good skin hygiene and keep the wound clean and dry. Also, observe the vital change. For our prioritizations number 4, we have acute pain related to extensive burn from its back and upper arms, as evidenced by grimacing and unable to verbalize intensity of pain out of 10. For the goal, for the long term of rendering nursing care, the patient will be able to express comfort and decrease reductions of pain. For the interventions, assess patient's pain, noting locations, characteristic, and intensity. Encourage expressions of feelings about pain, observe any changes on the client's vital signs, promote activity exercise in assessed positions. Also, provide non-pharmacologic pain management such as quiet environment, listening music, deep breathing, advise relaxations exercise, and activity by watching televisions or listening radio. Order IV fluid administrations depends on the doctor's order. Also, medications depends on the doctor's order such as morphine sulfate solutions. For prioritizations number 5, we have readiness for enhanced knowledge related to extensive burn management. For the goal, after 3 hours of rendering nursing care to the client wife, it will be able to understand toward its husband's needs and provide proper wound care and observe change, rest, and infections. For the interventions, we have verified client level of knowledge, demonstrate the proper wound care management, provide information signs and symptoms, which is blister, swelling, and painful skin. Also, encourage to do note by observing the improvements of the patient's wound healing and changes. Observe the risk factors in diet, educate breathing exercise towards the patients, provide access information to the personal health care, where at nurse or doctors. Utilize availability community resources in barangay health center, rural health midwife, and PHWs. And then for the recommendations and conclusions, it will be discussed by Mr. Labhata.
So for our conclusion, patient D is a 73-year-old man who has been brought into hospital by an ambulance with extensive burns to his back, arms, and legs caused by hot water. His wife, who is 71 years old, has accompanied him to the hospital. The wife reports that patient D was getting into the shower and had turned on the water. He appeared to have mistaken the hot tub for the cold tub and submerged himself in scalding hot water. He got a shock from the water and tried to get out but fell. The wife came in about 2 minutes later, turned off the shower, and called the ambulance, which arrived 7 minutes later, and paramedics began to treat patient D. Patient D is developing blisters around the edge of his back and down the dorsal portion of both legs. Patient D is visibly in a lot of pain, grimacing and calling out. He is unable to verbalize the intensity of his pain when asked for a score out of 10. According to the assessment, patient D has 20% deep partial thickness burn and approximately 20% mid-dermal partial thickness burn. His forearms are pink, indicating approximately 9% epidermal burn. Patient D is normally fit and healthy with a past history of mild hypocholesterolemia and some sporting injuries. His wife had a past history of chronic back pain from compressed vertebral disc at T5-6 and moderately severe osteoarthritis. For our recommendation, we would like to recommend patient D the appropriate nursing management for second-degree burns. Usually, second and first-degree burns is similar. Your healthcare provider may prescribe a stronger antibiotic cream that contains silver, such as silver sulfadiazine, to kill bacteria. Elevating the burn area can reduce pain and swelling. Dressing second-degree burns should take into account keeping the wound bed moist and protected, as well as clean. We also like to recommend avoid occlusive dressings, as they do not allow drainage of exudates and may provide an environment conducive to the development of infection. Also, when dressing burns that are over a joint, be sure to allow full range of motion. Lastly, because the client is older adult, we would like to recommend to eat a heart-healthy diet. Patient D should focus on fruits, vegetables, whole grains, and beans. Be mindful of fat intake, eat more plant sources of protein, eat fewer refined grains such as white flour, and most importantly is to exercise. The nurses play an important role in the overall management of a burn patient. We all know that handling a burn patient is quite hard. As a student, our learnings for this study are differentiate levels of burn, treatment and management for burn patients, pathophysiology of burns, and computation on how to get the percentage of the affected area or the total body surface area.
Additional po kung paano po namin nakuha yung total body surface area ng patient namin. So sabi po sa case is meron pong burn sa back, arms, and legs po ng patient. So dahil nga po back, nag-focus po kami sa posterior. So ang nilagay po namin sa back is 18%. For the right upper arms naman po, ang nilagay po namin is 2%. So bakit po 2% if 4.5 po yung nakalagay? Kasi po nahahati po siya sa tatlo, which is yung upper arm is 2%, lower arm is 1.5%, as well as the palm. So yung total po niya is 4.5%. So sa patient namin, right upper arms lang po, kaya 2% lang po yung nilagay namin. Next is sa right leg niya, 9%, and sa left leg, which is 9% din. So kapag tinotal po, yung back 18%, right upper arm 2%, right leg 9%, and left leg 9%. Ang total po niya is 38%. So yung total body surface area po ng patient namin is 38% po. So that's all po for the group 2. Thank you so much and God bless.